I'm Meredith Armstrong, and this is The Doctor Is In. This week we have with us Dr. Dunya Muhammad from USA Health Pediatrics, and we're here to talk about hypertension in children. Dr. Muhammad, thanks for joining us.
Thank you for having me.
What is hypertension in children?
So any elevated blood pressure in children that meets certain criteria for their age, gender, and height can be defined as high blood pressure. What is important is that these blood pressures needs to be taken in a setting when the child is calm, quiet, sitting, and relaxed, so it's accurate. It needs to be from upper extremities to be accurate, and that's how the standards are based on, and on 3 different occasions, because there are a lot of factors that could contribute to high blood pressure, like stress, pain, and anxiety. So you want to have multiple measurements that are consistent with high blood pressure to diagnose a child with hypertension.
How often should a child get blood pressure checks?
Routinely, the American Academy recommends well-child visits starting age 3 to have documented blood pressure in children, and then after that annually. But then there are certain children who are at high risk for hypertension. Those include children who are born premature, so any child less than 35-week gestational age, children who are overweight or obese have to have every well-child blood pressure checked, even less than 3-year-old, and then children who are on medication who that can cause hypertension or have diseases that are known to be associated with high blood pressure.
So you mentioned perhaps overweight. What are some other causes?
So the main organ that is responsible or causing hypertension in children is kidney disease. That's why nephrologists are the ones who see patients with high blood pressure. Now, heart disease also in young children could be the reason for the high blood pressure, and there are certain genetic diseases that are known to cause hypertension. So those all together are the 2/3 of causes of hypertension in children.
As far as testing goes, you mentioned a couple of different 3 or 4 blood pressure checks. Is there anything else that you use to diagnose this as far as testing goes?
For the hypertension itself diagnosis, no, it's a clinical based on the blood pressure measurement, but to find the underlying cause of hypertension, that's when we mainly rely on the history. So if there's a family history of hypertension or a certain genetic or kidney disease, that's a clue on how to move forward in investigation. But also the child's overall exam, as I said, the weight, how high is the blood pressure, is there any birthmarks on exam, is there certain indicators of a systemic or a kidney disease. But in general, all children with diagnosis of hypertension need to have urine testing. We're mainly looking for blood and protein in the urine, which suggests kidney injury or disease. And then we're also doing blood works to check their kidney function. And children should also get a kidney bladder ultrasound to make sure that they have 2 kidneys, the size, any mass on the kidneys. That's all helps together to reach a diagnosis.
How common is it? How often do you see hypertension in children?
Much less common than adult, although it still affects 2 to 5% of children. Different age groups have different prevalence of high blood pressure. It's more common in school-age children. So children between age 7 and 17 are the highest rates of hypertension.
What is something that you wish maybe your patients knew specifically about hypertension in children before they come see you?
So I think knowing that weight relates to blood pressure and hypertension is, I think, important. Every parent should be aware of that. It's not just the appearance, especially in children. We don't, as parents, we don't really care as much about that. We should know more the consequences of weight, and because more and more studies, and unfortunately the pandemic didn't help, that more children stayed home, less active, less exercise, more weight, and then we can see that blood pressures are going higher and higher. And one more thing that I want parents to be aware of is salt, and which is known to cause high blood pressures, and children who are diagnosed with it should avoid salt. Now, unfortunately, American diet is rich in salt. An average American person would take 3.5 grams of salt on a regular day, where it's supposed to be less than 2.5 grams. And that also applies to children, especially with snacks and stuff that are salty. So I would highly suggest parents check food labels to see how much salt is in the food. Now, when you look at the label, we generally say salt, but it's actually the sodium, the sodium content of the salt that matters. And if parents try to keep that less than 2 grams or 2,000 milligrams, that would help control and avoid high blood pressure in children.
Good to know. So it starts in the grocery store.
Yes, food labels should, it's just getting familiar with it and how to interpret it, and the serving sizes, it's good for the whole family. This is not only about children, it's also for the whole household. Low salt diet is healthy.
Wonderful. Good to know. Thank you, Dr. Muhammad. She is with USA Health Pediatrics. So if you have any more questions, you can visit her there. I am Meredith Armstrong, and that is all we have this week for The Doctor Is In.